We're excited to be presenting from the Beck Center for Social Impact and Innovation from Georgetown University. And so today, our topic is data and disasters, harnessing the power of open data to strengthen emergency response and recovery. You're going to hear from me, Kels, Sarah, and Katya. And we're going to tell you first a little bit about we are at the Beck Center. I'm not going to read all of this, but if I do, I'll try to jump around. But at a high level, we surface, accelerate, and scale interventions that fill gaps in our society and foster and accelerate social impact. We're a training ground for students. We are at Georgetown University, so that is core to who we are and what we do there. And we're an incubator for scaling leading edge ecosystem ideas for the common good. Our work centers on investing in outcomes for individuals, and we believe that scaling and impact it's a team effort, and it requires us to think outside the box, behave a little bit differently, and collaborate in new ways. I think that's one of the strengths that we have in higher education in particular, and in government, for those of you calling in from government, where we can be neutral conveners in ways that certain organizations and some industries cannot. So we're just happy to be here and to convene and gather today. A few framing thoughts before I hand it over to Kel, then Sarah, and then Katya, is that our speakers today, including myself, we've been working in state and local government directly. We're working shoulder to shoulder with practitioners who are doing the work, who are in the trenches, so to speak. So you're going to hear from some of these applied experiences from our speakers today. And a crisis, is we're going to get into, is a great learning moment for how we build sustainable, equitable, and accessible data solutions for not just our organizations, but for the citizens that we're serving, both domestic and in some cases internationally. And then data are core to how we design government for humans. Let's not forget that this is an important, ever-evolving function of how we run our organizations and how we make sound decisions and also connect with the people in human-centered ways. So just a few thoughts there. I'm going to stop talking. I should say quickly, my name is Kevin Barker. I'm from the Beck Center. I'm here as a moderator today, but really I don't need to do much work because we have such an amazing lineup here. And I'm going to kick it off to Kel, and I'm just going to drive this deck. So Kel, I'll just work with you and we'll keep going.
Thanks so much, Kevin. And hi, everyone. I'm Kel, like Kevin said, and I'm a senior at Georgetown studying science, technology, and international affairs. And I've also been working with Beck for about 3 years as a student analyst. And so I'm this year writing my undergraduate thesis, and I wanted to write it about something on civic tech because I've been working at Beck and that work is so exciting. And I was particularly interested in the work that another Beck fellow, Denise Ross, had done previously in New Orleans, because she had told me about this amazing story where she had worked a data intermediary and when New Orleans was hit with Hurricane Katrina, and how much impact they were able to have by partnering with private sector partners and local government to access and share good data. And I was really interested, and sorry, I'm giving a brief introduction, but I'll go into the case in a second. I was really interested in this idea of crises as an opportunity for this kind of collaboration, because on one hand, people need to understand the damage. So the information deficits that we have across government and in the private sector are more glaring than they usually are. And at the same time, private sector incentives are more aligned with community rather than profit as they normally are, because everyone needs this data to be able to rebuild. So I thought of this as an opportunity to bolster corporate social responsibility and bring new stakeholders into the open data movement, and was interested in studying how these projects are happening, if they are happening, and then also how to capture the learnings from these successes, because they're often happening under extraordinary circumstances and not always well documented, so that we can continue learning and improving when we're bringing data into response and recovery. So I interviewed a bunch of practitioners with hands-on experience, and I'm going to walk you through some of these cases. And so our first one is Hurricane Katrina in New Orleans, where the two major players were kind of the local government with really low data capacity. So nearly half the city's IT staff were contractors. They had to outsource a lot of core GIS functions. And if it tells you anything, the city's website domain was literally cityofno.com. On the other hand, there was the data center, which was a local data intermediary focused on making statistics accessible and relevant to the community, which normally meant to nonprofits, providing information so that they could ask for grants and also know where to serve the community. In the wake of Katrina, though, the data center quickly became an information hub for everyone from local residents to international news media. And this was not a coincidence. This was because the government's poor data practices, which they continued sort of into the crisis, left kind of an information vacuum. An example of this is that they were sharing out a daily dashboard, but only with some stakeholders. So it had to be individually forwarded around through email, and not everyone could access this information that they desperately needed to understand what the landscape looked like in New Orleans. The data center, on the other hand, had really good tech and, even more importantly, strong norms around using it. So they put their servers in Kentucky outside of the floodplains so that when Katrina hit, their website was still standing when many others went down. And then they also had done lots of user testing for this website. It was easy to understand. They used simple everyday language to describe the data sets so that when they were providing this information, they were making it actionable for all of their users. And so while the data center was working, while they were providing information to the community, they were also trying to understand what they needed most. So they searched for indicators that showed like how the population was recovering as one of the highest value data sets that they found. And what they found was that the government had this data in the US Postal Service, but there was a time lag and there were bad geographic boundaries that changed over time. So it wasn't really possible to visualize the changes in post-Katrina New Orleans. Instead, they were able to identify a private sector partner, which was actually a spam mail marketing company called Velasys, and buy their data off them for a very low price, which Velasys actually started donating the data later to give people the information that they needed to make decisions about rebuilding, because Velasys could tell them which households were receiving mail, and so which neighbors were moving back in, where businesses should be reopening, and where the local government should be providing aid, as well as the federal and state government. And I thought this was a really compelling story because, one, it showed how they were providing data throughout this ecosystem that included like individual residents to the Army Corps of Engineers and city council and private investors. And then also, as the data center emerged as a leader in this area, they were able to document which factors were successful and actually help guide the New Orleans government in strengthening their IT systems, updating their job descriptions and salaries, stabilizing their infrastructure and procurement processes. And through this, they were able to kind of take their own improvements and make the whole data ecosystem in New Orleans stronger. And this kind of mutual improvement was also happened through a different process in my next case, which is the Tubbs fire in 2017 in Santa Rosa, California. This was one of the most destructive fires in California history. Around 40,000 residents were evacuated and had literally no idea whether their homes were still standing. And they had no mechanism of finding out because the local government couldn't provide this information right away. And the National Guard was guarding their neighborhoods, so they couldn't get in or out to check whether their home was standing after these fires. So during this state of kind of mass confusion, a civic technologist named Robin Kraft, who had ties to Santa Rosa, noticed that 2 satellite imagery companies had released their data for free through their open data emergency programs. And he was able to stand up a pretty simple tool to search your address and see the damage, which there's a screenshot here, to let people know, like give people this information in the immediate aftermath of the fire. And a civic technologist or a technologist working at the Santa Rosa government noticed this and was able to embed it in Santa Rosa's main website during the fire. And this was really important because his name was Jake Bayless. Jake noticed that the government had the mandate to provide this information, but they didn't have the capacity to do so. So there was kind of an equity issue with leaving this tool just open in the Twitter sphere for whoever happened to be checking social media. The government really needed to be providing this through channels that everyone had access to. And I think something really compelling about this too is that Jake actually wasn't working as a technologist. He was working as a public information officer, supposed to be pushing out messaging. So it was really lucky that he was able to see this opportunity and be thinking about the data side of things and pull in this sort of vital information that really gave people a lot of relief and the information they needed to move on. But it wasn't an institutionalized part of Santa Rosa's preparedness. And that was something that I kind of found across these pieces. So there are some mechanisms of taking these learnings, like for the fires, there's mutual aid. And actually, Kevin, if we could switch to the next slide. But a lot of times these projects are happening in sort of isolated arenas, and the wonderful technologists that are carrying them out have to move on to the next crisis immediately. So there's no documentation or institutionalization of these learnings unless it's kind of localized to one organization or sort of one city. So that definitely needs to be improved. We shouldn't be relying on coincidences and happy accidents to guide our response and recovery. And then additionally, the role of data intermediaries and civic technologists is increasing. As we have access to the internet, volunteers are able to fill in a lot of the gaps that when local government doesn't have the capacity. But at the end of the day, we need these technologists to be in government because this is where the authority is. This is where we can make sure that our sources are strong. And this is where people know to look for information, because a lot of the times there's just this disconnect between it actually being available and people being able to access it. because having the data in the open, as we all know, doesn't really mean anything unless it's being used to inform decisions. And then finally, that the best way to ensure that we're centering sustainability, accessibility, and equity while we're going through these projects is by preparing early. When these relationships and these data sources are vetted sort of before the crisis actually hit, it gives us the time and space to think about all these factors and everything from who's represented in the data set to how we actually share out this data, whether that's through social media or mainstream news. So that was kind of a quick overview of the research that I've been doing on my thesis, which I'm honestly not completely done with yet. But I'm going to pass this off to my colleagues to talk about how this work has continued evolving, because I was looking at pretty localized incidences, and we're obviously in the middle of kind of a global crisis right now. So I'll pass this off to you, Sarah.
Thank you. My name is Sarah Schott. I'm a fellow at Georgetown's Beck Center. And while the core focus of my fellowship is on public interest technology workforce, I was pulled in on a project to create perhaps an example of a COVID open data standard. My experience in this field is I've worked in public interest technology, civic tech, OpenGov for over 15 years. And the last 7 have had a real concentration at the intersection of public health, environmental health, which is more about like the safety of your water than the safety of your trees, and data standards. So it was with interest that I started engaging on the potential to create a COVID data standard, and ultimately brought that project to the Beck Center. I want to acknowledge that I work with 4 fantastic student researchers at the University of Washington's Informatics School, and they've contributed a lot to this research. We are producing a report. This is a bit of a preview of the report, and I'll give some high-level findings from what we're seeing here. Feel free to email me with subject line COVID report if you would like to receive a copy of the report when it comes out. All right, so first slide. One of the largest challenges, and I'm sure many of you who have, like most of us, checked COVID numbers, notice that states and other jurisdictions like municipalities were releasing data on dashboards that were human readable, not machine readable. And this actually required civil society organizations to stand up quite quickly, the capacity to scrape information across not just 50 states and several territories, but also across thousands of municipalities. We had USA Facts that had transitioned a lot of its scraping to automated, but still had to go to California counties to get death numbers, because by the time it made it to those death numbers made it to the state's dashboard, they were actually at a 24-hour or more lag to what was available on the counties. If you check the CDC's death numbers, they were running 3 weeks behind what you could find with some counties. And essentially we had, projects like COVID Tracking Project, which were using hundreds of individuals to scrape information, normalize it, and republish it to the public. And these were all really valuable contributions, but they were necessary because we didn't have enough open data on COVID. And in fact, those civil society organizations and the data they were scraping was being leveraged by the CDC itself because it was better than what the CDC could access. So there was real challenges around COVID data. We're getting to a better point as a nation with a lot of fairly recent modifications to how we're gathering and on the national level, gathering and publishing COVID data. But I'm going to talk to you a little bit about really the challenges of getting to both a COVID data standard and also to getting really the capacity to surface that data. When I was initially asked to help create a data standard, because of my experience developing 2 other public health data standards, my immediate interest was in, well, what's actually available? And I think that there was a misconception that governments were holding back data. And while I'll get to some of the challenges around sort of asymmetry in a COVID data access, I want to first say, like, you can't standardize or organize data if you don't have it. And so I really wanted to dig in and ask, why are we seeing these gaps? So this is a quick snapshot of some of the analysis my team and I have done on which metrics and COVID metrics and labels associated with those COVID metrics are available through state dashboards. So this is just looking at all 50 states. What you see here is on the scale, it's 0 to 50. So you can see, like, we've got several metrics where, we're maybe hitting at best a third of states publishing it. The model of research we took was first to do an ecosystem scan of what is available and leverage resources from CTP and what's publicly available in states. And then also to do key informant interviews. So we've interviewed 10 states. We're on track to get to, I think, 10 counties or more that we've interviewed. And so what we found is the reasons why we lack data are oftentimes because of governance models impacting the capacity to process and essentially ingest data. So in the United States, we have about a half dozen models for public health. And this ranges from a centralized health department, which is at the state level, which is collecting, managing, essentially monitoring disease in their state. And we have, I think, about 23 states that are on a highly decentralized model. That decentralized model means that tiny county governments with sometimes, a handful or fewer public health officers were suddenly thrust into counting thousands of test results per day and turning that into machine readable data where it had been submitted to them in faxes and hard copy and phone calls, and then getting that somehow into their state surveillance system. These legacy surveillance systems oftentimes did not include in their original surveillance system, because these are set up to check things like hepatitis A outbreaks and E. coli outbreaks, these sort of things. They didn't have negative fields. So you couldn't enter negative tests from COVID into your database. So counties ended up with stacks of negative test results. And essentially they just really struggled, especially in the decentralized model, states really struggled with this capacity on the municipalities' end to then get information into the state databases. And the state databases frequently broke down due to the volume and due to the amount of time that each of these municipalities in their state had to spend on data entry into the systems. So quite often, that was manual data entry. And so many counties actually developed their own internal kind of secondary databases to be able to make sure that they had a source of truth for their county, given that at any time when they're uploading data and manually entering it into the state system could break down on them and they could lose all the data they had just spent hours entering. We really lack the political will in many states, not all, but many states lack the political will to enforce data collection minimums on testing and medical service providers. And, a year into the pandemic, I think that this is really an issue that the Biden administration needs to get serious about. We have states where people who businesses that didn't exist popped up in order to provide testing. And those businesses, as we heard in our key informant interviews, were not always providing data to the states or the municipalities on their testing. This is particularly a problem with antigen testing, which tends to happen on college campuses. This is the rapid testing. And so we really have missing data. And so if you're frustrated with your state, if you're frustrated with your county public health department, be also frustrated with your medical providers, which may have ignored electronic medical records requirements and or lawmakers, executives decided not to enforce medical records requirements. And this is also why we lose a lot of opportunities to collect demographic data in testing and in cases. So I'm just I know that that was a lot of information presented on a little slide. Sorry, Kevin, I should have had you move that slide earlier for folks. But you can see where, we have things like negative tests which are running quite a ways behind, say, negative people or cases are easier to track. So, and that's because they're coming through different data entry systems that have more or less capacity. So we really looked at a way to create a data standard that was taking all of these factors into an account and looking at, okay, what fields do we feel confident based on the data available, at least 20% of states could adopt that field if it was a required field. So in data standards or in schemas, you have required fields, you have optional fields. I always go for trying to create a minimum small reasonable threshold for a 1.0 to get as many people into sort of a foundation level and as many states or jurisdictions into a foundation level as possible. And so an example of this is positive tests PCR. We analyzed the 36 data dictionaries from states in the US. We also analyzed the definitions that COVID Tracking Project had put together for the fields that they put out. And then we analyzed, well, what's the spectrum of terms that are being used here before we settled on a potential required field, a label to use, and a standardized definition. I want to give a shout out to Tennessee, who we found had the best data dictionary of COVID data in the United States. So congratulations, Tennessee. You're doing great work there. And it was an honor being able to also interview their team and see the tremendous work that they've really put in at their public health jurisdiction. Why so few fields? I talked about this a little bit before. And by the way, this map here, this chloroplast map, is essentially our analysis of being able to get to a minimum of 14 required fields. So you'll see some are lighter, some are darker. This indicates the darker they are, that indicates how far they'll get to those 14 required fields. Though certainly there are those in there that have a lot of fields that could be added that are optional fields. So we talked about missing and incomplete data, systems being outdated, particularly the disease surveillance systems held at state levels. And the large volume was both a problem on a staffing level, the large volume of tests. So, I had jurisdictions that reported to me, we went from processing 35,000 disease incidents per year to over 1 million, right? So you think about those scale and capacity issues. It's no wonder we weren't getting the data we needed in the time we thought we needed it. They had real communications issues in terms of if you saw different stats at a county level versus a state level. This was often because a county had a framework for what they thought was important age grouping or labeling that was unique to their area and perhaps wasn't the same value the same as the state. And then I want to take a moment to say asymmetry across data access. In states that have centralized public health, they were advantaged in many ways in terms of tracking COVID data and the scale and capacity that they had already on hand. However, their local jurisdictions often complained that they were not able to get enough of their own data from their own jurisdiction from the state, because the state was the holder of all of that information. So we had municipalities reporting they couldn't forecast their infection rate or their transmission rate because the lack of fields coming from the state, and that they didn't have data sharing agreements, or the data sharing agreements they had were so restrictive that perhaps they could access this information and use it internally, but they were prohibited from communicating it to their public. So we have real challenges there. Next slide. Finally, I want to say that we did an analysis of who are the vendors who are producing data dashboards, because these data dashboards are ingesting machine readable data. So it stands to say, well, we could be opening data through the open data tools connected to these dashboards. The vast majority of our key informant interviews shared that they didn't understand how to open up data from their dashboard. So if they had Esri, they weren't sure how to put it into an ArcGIS queryable database. If they had Tableau, there was only one instance of a government that seemed profoundly pro-open data and knowledgeable that used Tableau's open data example. And many of them had the misconception that if they opened their data from the dashboard, they would inadvertently expose line data. So this would violate HIPAA. There was a real misconception about HIPAA or challenges around HIPAA. And I think it's interesting to point out here that as we completed this research, Tableau's slice of the pie grew, often eating up a state in dark orange state-maintained dashboard or website. And yeah, ultimately, I think that there is worthwhile engagement to be done with these vendors to make sure their clients are opening up data and using a data standard. Thanks. I'm looking forward to questions. Oh, and I also have another slide. Great. Thanks, Kevin. Yeah, so here are some of the things that folks need. I want to be sensitive to time, but ultimately, staff need more time off. They need clear guidance on HIPAA. They want federal government support and they want federal government guidance. And they want the federal government to basically give guidance so that the relationship between counties and states, public health agencies are easier, especially in those distributed groups. And I'll just close with this, that I was told the story of a really extraordinary team that had public health informatics professionals on it. I think that they were doing great work under pressure. And this individual told me that they had had just 4 days off since the pandemic started, 4 days off, including weekends in the last year. And that their team of less than 10, even though they'd been able to expend by 3, still had to occasionally drop everything and go swab noses because that's how poorly staffed they are right now. And so I think it's really important for us to both hold public health accountable, but to also, if we want data standards, if we want improved data, really look at an empathetic lens to what these counties and states are going through right now. Thanks.
Great, thanks so much, Sarah. I am here to build on everything that Kel and Sarah have shared so far. My name is Katya Bazajian. I'm a fellow with the Beck Center. I have conducted this research that I want to share in coordination with the State Chief Data Officers Network and with Tyler Claycamp, who's also a fellow with us who leads that network. So just a little bit more about the State Chief Data Officers Network. We're a learning network for data leaders across states. We work to improve policy and service delivery. What that basically amounts to is that we're helping states share best practices across each other to share strategy. We're helping them to build toolkits and resources that will make it really easy for them to implement things that work. And we are supporting the development and application of those tools in real life kind of pilot projects with states and working on specific issues and use cases that they're addressing. Before we dive in, I just want to say broadly that the research that we did was very generally on economic recovery. And if we can go to the next slide, just to give you a little bit of background on it, when we say economic recovery, it's a very broad term that a lot of people are throwing around right now. And I'm sure it has a million different definitions according to who you ask. But very generally, we looked at any kind of issues that are related to labor, to healthcare, to people care. We looked at any kind of issue that would affect our workforce's ability to get back to work. And that includes a lot of wide-ranging issues, including access to internet, access to health, behavioral services, and things like that. So this research was compiled based on interviews with advocacy groups primarily and subject matter experts working outside of government. So we were trying to get a hold of the folks who are used to working with state governments, but not actually within states themselves, just to give us a better example or understanding of what they're asking states to do. We spoke with state CDOs as part of the network and conducted some focus groups with them to figure out what they find interesting, what's in front of them, what's strategically aligned with what they're able to work on right now. And we also did analysis of state of the state addresses before COVID. So we had originally done this research to understand what governors felt were states' priorities and how often they were mentioning data as a priority. And as you might expect, governors are not very often mentioning data reforms as priorities in their platforms, which is something that has changed really drastically in the last year. So we've seen just really shortly that that perception of the importance of data is already starting to shift. And this report is already public. We published it in August of last year. And at that point, we were, if you'll recall back to that, feels many years ago, but at that point, we were just kind of we were hoping that the first wave was going to end and that at some point we would have an opportunity to think ahead about recovery and about what people need in the coming months and years. And the way it actually has worked out, as many people know, I'm sure, is that governments have been on the back of their heels essentially this entire time and have been still, as Sarah said, really overwhelmed with response. So we're hoping that this research and updates to this research that we do in the coming year will hopefully provide a roadmap and kind of a framework for state data practitioners and for officials to think about how data gets used in policy and in data reform projects in the coming months. So I just want to run through broadly some really general challenges that we came across in the research. So CDOs, and this is primarily from CDOs, but also people who are working with CDOs or people who are data stewards or responsible for data at the agency level. CDOs have a hard time doing metadata and data management in a crisis. So they're very much, as Sarah said, we saw the same thing in data offices. Some of them have been working around the clock, and they have identified that like the sustainability practices that we know work, documenting your data, making sure it's clean, making sure others can use it, facilitating sharing, collaboration, really go on the back burner when it's crisis time. And that's creating issues for CDOs where they're accessing public health data for the first time. Many of them, they're getting access to a lot of data that is very high urgency and executive asks for kind of data analysis. And there really isn't time to do some of the long-term systemic building work that would be required in order to make sure that these systems are actually changing based on what the public's needs are right now. So that's definitely a concern. As we saw in the media, there were lots of conversations early on about the fact that states were publishing data that was not disaggregated by race or ethnicity. A couple of CDOs pointed to the fact that the data systems just aren't built to collect data in the way that we really need to be collecting it to understand these discrepancies. That kind of ties into issues with budget deficits and lack of investment. So, you know, data offices are generally kind of short-strung to try to figure out how they're going to allocate limited resources on building these really massive infrastructure projects or on building long-term data governance practices. But now, especially with the shortfall that states are seeing or are going to continue to see for the next year, CDO offices are definitely at risk. There are a couple that are already being downsized. And it really is kind of antithetical to what we're seeing in the civil society space, that more investment needs to go into data and technology, where at the state level, we're actually seeing money being taken away from those offices in the process of doing the kind of priority emergency response. Some of the big data projects that CDOs have spent a lot of time and energy on and that produce a lot of really high quality data are difficult to maintain in the long term and are not always the most tactical option for actually getting analytics or kind of short-term needs met with regards to data. So with that, they kind of pointed out that, you know, like 5-year investments in integrated data systems and even longer investments in those big data systems are really helpful for really specific tasks, but they should not be the default option, which can tend to happen. And finally, the handling of personal data is something that's gotten a lot more attention in the last year as well. And kind of as Sarah alluded to as well, there aren't a ton of practices outside of HIPAA and FERPA that are being applied at the state level to actually protect people's personal data in any kind of intentional way. And because of that, there is a lot of confusion. We saw that in our research as well. There's a lot of confusion about what can be shared and what can't be shared. It kind of seems like a black box to people, and attorney general and other legal experts end up being solely responsible from state to state for determining what falls under these kind of federal protections and what doesn't. So there's a huge gap in personal data legislation at the state level that would actually protect these issues. So very broadly, the report that we published focuses on use cases for state governments to use public data in one of these four areas. And the reason why we took such a high level approach is that we found that CDOs really need support to understand the policy side of what they're being asked to do. So many CDOs are kind of very in the weeds with data, very much working on data governance, data sharing, documentation, open data, and they aren't always pulled into policy conversations when they need to be. And so this research was an attempt at identifying where there's crossover between executive and legislative priorities and the priorities that chief data officers can create for their agendas that can really integrate nicely and make sure that data is being applied in situations where it's going to be impactful. So we have a number of use cases cataloged in the report, and I'm just going to highlight one use case in each of the sections and let others kind of go through at their own speed. But the first section is on workforce and education, and an interesting use case in this category was integrating workforce data with other programs to serve hard-to-serve individuals. So this is actually something that we identified because of a mandate that is buried in the Workforce Innovation and Opportunity Act to integrate workforce development programs with social service programs by identifying who is high need essentially across services. And this just speaks to the fact that as part of doing this research, we found that there are a lot of existing federal initiatives and programs that are realizing that the interoperability of data and the crossover coordination across systems is really important, but that we have yet to see kind of statewide coordination on these kind of efforts because they require so much coordination at the higher level. So this is one example of a use case where integrating workforce program data with other social benefits programs could be an opportunity to identify who is reaching across those programs and how to serve the whole person more effectively. The next category is on health and benefits. So we obviously have seen the importance of data in delivering things like unemployment benefits this year and really realized how important the work is that technologists are doing to streamline access to those benefits. We were thinking a little bit more behind the scenes on how data can help inform the policy decisions that health and benefits providers are making at the state level. One interesting use case that we found that, again, was kind of unearthed by digging through data systems that people are not usually thinking about is looking at all payer claims databases as a source of information for understanding geographically and on a local level where healthcare costs are being expended. So many states have all payer claims databases. There's an advocacy group that works across states helping them develop these. But they're mostly only used for insurance analysis. They're used by really kind of specific niche researchers on insurance needs. And granted, these data systems are really hard to get access to, but they have a lot of really important information about individual level uses of healthcare programs. So while not all of that data would necessarily be suitable to open data, there is a huge opportunity to figure out what is relevant from those data sources that other departments can use to understand how healthcare costs are affecting benefits or how they're affecting people. The next category on neighborhood well-being, this one kind of really varies based on where you are because this category generally is a catch-all for local and county level issues where we wanted to encourage state governments to be a little bit more cooperative with governments below them essentially and act as conveners across regions and cities. And one really huge issue area that we're seeing emerge is around evictions and thinking about how states can be better conveners for sharing evictions data. Homelessness and evictions have naturally, as we have seen in the news, skyrocketed because of the economic crisis. And the challenge in that space that we've seen is just that states are not necessarily stepping up in the way that they could to help counties and court systems actually publish that data openly in a way that would help both tenant advocates and researchers and advocates of all kind of at every level to better understand the housing crisis right now. So that one, I think, really is, I want to stress that I think states are not necessarily taking up the mantle that they could, and it's a really huge opportunity for states to be better conveners of cities and regions to enable data sharing and publish more open data that aggregates upward. And finally, we included a category for kind of the budget reallocation and shifts that states are going to have to make this year. So as I mentioned, states will have massive financial shortfalls this year. And we encourage, some CDOs are involved in performance management decisions and kind of evaluating data for those purposes. And we wanted to point to specific areas where the data has already shown in other states that there are opportunities to shift or reallocate money towards or away from certain things that are going to become increasingly important in the road to economic recovery. One of those is just that the multiple states have participated in a program called the Justice Reinvestment Initiative, organized through the Urban Institute's Criminal Justice Policy Center. And they have validated that the cost savings is on par with the social benefit of closing youth detention centers, just based on the fact that those types of justice systems don't actually create any positive outcomes for youth or into their journey in adulthood. So there are multiple examples of kind of specific research areas where we can look at budget reallocation from a data perspective. So just broadly speaking, I just wanted to point to some of the states that are already starting to use some of these use cases that we know of through the CDO network and that we've seen chief data officers become involved with. So Indiana starting to secure more funds and use a data-driven approach to delivering food assistance. Arkansas and other states that have come before them, like Georgia and Pennsylvania, developing their own broadband accessibility maps, and states like Connecticut starting to do work on small business impacts and understanding where the local needs are there. I want to end on just these high-level recommendations. I think it's pretty clear throughout the research that there needs to be a really strong push from a high level for data to be a priority of executive and legislative agendas. Many state chief data officers spend their time trying to do data competency workshops, teach data 101, encourage data sharing, really kind of foundational cultural work that needs to happen to even convince people that data is something worth investing in. That's the situation that states are in right now. I think we need to be more intentional. We've seen that we need to be more intentional about the design of data systems and what data they're collecting and why. That kind of relates to the equity lens of making sure that data systems are actually collecting information on race and ethnicity and other demographics that make it important, that are important for us to actually understand what's going on with people, and also to downsize unsustainable large systems and really just focus on lean data collection and lean data sharing that prioritizes only sharing what's intentional and necessary. And finally, supporting data inventories that would increase transparency, allow the general public to see into what states have, and also allow agencies to better collaborate with each other. So I will end on that hopefully positive note and pass it off to Kevin for Q&A. Oh, sorry, I also did what Sarah did. I wanted to add that we are working on a new program for state CDOs in case anyone is interested in getting involved with that. We are creating 4 different kind of cohorts for chief data officers to learn more about the specific use cases in their states and to share really tactical lessons from that. So these are the 4 focus areas. And if you're interested, please do get in touch with us via email or on Twitter.
Wow, thank you. Kel, thank you, Sarah. Thank you, Katya. We have the next hour for Q&A. Just kidding. We have 8 minutes. I want to respect people's times. And I know that we do have a slide here for inviting you to stay in touch with us and to keep the conversation going. I'll come back to that slide in a second, but does anyone have any questions? I would encourage you to unmute. I'm not going to look for hands. Just let's open it up for conversation if anyone has any thoughts or comments. I see a few dozen people in this room, so I know there's questions and thoughts. If not, I'm happy to take up a couple of seconds to ask some questions, but does anyone have any questions for our panelists, Kel, Sarah, and Katya? Could be anything.
But I am guessing that the question is referring to the difference in data coming out of private hospitals versus public hospitals. That they left all the data off in spring, left off all data in spring. That's interesting. Based on lessons I learned from interviews in the Key Inform interviews, a couple of reasons behind that could be, assuming good intent, that either A, they did not have the data entry capacity at the time to enter the data at the private hospital. That has been a constant problem. B is that during the spring, there was a bunch of changes in terms of how public health jurisdictions were requiring data to come to them. And it seems like some of them were communicating to me that their public institutions were essentially being held more accountable on producing data than private entities. And this was especially true with urgent care clinics that are privately run and testing clinics that were privately run, or testing that was being completed for private entities on a regular basis. So this could be college campuses or basketball teams or others. So I would assume that part of that is due to capacity, but also due to essentially executive or council lack of enforcement. But those are just hypotheses, and I could be wrong.
Thank you, Sarah, for jumping in. I see another question. Just in the interest of time, let's jump around a little bit. There was a question, Katya, about what's keeping states from creating CDOs.
Yeah, that's a great question. We have, I think, just over 30 states with CDOs at this point, although the number is changing because sometimes states lose CDOs. But generally speaking, I think this is many CDOs are appointed when there is a governor or an executive office with a priority for delivering better data solutions, essentially. And I think that applies across situations where CDOs are housed in the executive office or in IT departments. I think that even with the states that do have CDOs, many of them are very, very new, so I think generally what most states are dealing with is a lot of culture issues with even just introducing the best practices of using data. And that's one area where people with experience working in cities can help out a lot, because cities have kind of gone through this initial growth phase already of how to instill CDOs and learned lessons about where it's best to situate them and how to manage governance internally. And that's kind of what states are going through right now. And maybe I can also answer the other question that I'm seeing here about what states wish they had data on, and I'm curious to hear others' thoughts on that as well. But I think I think just what they would do differently, actually. I wanted to share an anecdote from a couple of states, actually, who mentioned that when their states started doing emergency response functions, CDOs were not allowed to join the meetings. So they weren't considered essential for emergency response in the early stages. And one CDO even mentioned that they received kind of outreach weeks later from a data analyst who was then tasked with doing the entire kind of data function support for that emergency response task force. So that data work gets done one way or another, and you can have someone who's an expert in it, or someone who is going to have to figure everything out for themselves. So I think one thing that many CDOs wish they'd done differently is really encourage the agencies that they're working with to bring them into infrastructural kind of talking strategy meetings very early on, and to allow them to be a fly on the wall in those kind of response and recovery functions so that they can provide the actual necessary resources later on.
Well, there's one question about, given the large sources of data available, data quality at source is an issue. Have you thought about how to address this? Models can go wrong if this is not kept in mind. I think that's a great question. One of my questions as our panelists were speaking was, how do we ensure that the data have integrity? Do our panelists have any thoughts on that? Data quality. So loaded. You have 1 minute to respond, but does anyone have any quick thoughts, maybe headline thoughts on that?
I would, wherever possible, especially with COVID testing, create easy, especially mobile-driven processes for those being tested to enter their demographic and other information themselves, and to link that with an identifier, which could be their name and the date of the test. This this would help a lot to relieve some of the data entry burden.
Yeah, I think to the point that I made in the presentation, I would also add that I think many of our systems are just not built with the intention of doing really robust data analysis. Many states are dealing with legacy data systems that many data systems are created for the purpose of grant reporting or federal funding reporting, and many of them are designed with the specific purpose of answering the questions that are kind of reported up to the federal agencies. So these systems are not being designed to prioritize kind of, I think, modern standards of data quality, and could definitely be improved to kind of track with best practices.
Kel, do you have anything to add?
Yeah, I was just going to say, I think that we found that that doesn't happen voluntarily. And even when it's like suggested, often organizations say that it's not possible. So we, like in a lot of my research, I found that people need to have like a large incentive, like they need to be they don't get reimbursed from Medicaid, Medicare, unless they switch to systems that are more updated. So I think it's a question of finding out what incentives we can drive so that everyone is on an even playing field, because it's not going to happen voluntarily. It's only if like there's really funding attached, or sort of you can't sit at the table unless you're adhering to certain standards. And I think Katya's right that like it has to be kind of for everyday use. It can't be just in a case of emergency, we suddenly build this infrastructure that didn't exist before. So we have to like keep in mind that these crises are happening and take our learnings from them and apply them moving forward.
Thank you for that. This is a big question Elizabeth has in our chat. Do you think about intentional misrepresentation of data as what looks like maybe the case in New York State with nursing home deaths categorized as hospital deaths, or any states protecting CDOs and their staffs from pressure by legislative or other means? Does anybody have any thoughts on that?
Yeah, I think that in my experience, at least at the state level, I mean, I don't want to dive directly into the hot button issue, but we know that there have been data challenges in Florida, for example, at the state level, and with CDOs being on the side of trying to protect the integrity of data before it's being published. And I think in many cases, I've heard from CDOs that they are very actually responsive to pressure from the community. They recognize that they do need, that their function as part of running open data programs is responding to community needs. I think that whether executives and legislative electeds are actually adhering to that, or whether they are engaging with the conversation that needs to happen around the integrity of data and publication of open data is a different question. So that probably varies very widely state to state.
I would share that, in the case of nursing homes, while we use the term nursing homes kind of as a catch-all, I think in conversation, it actually means a specific category under the law. And nursing homes are required to report to the federal government their COVID numbers, whereas adult care facilities or assisted living facilities can fall sometimes, depending on how they're defined and how they're set up, outside of these reporting requirements. And so I think that essentially our lack of uniformity at looking at requiring data out of these type of facilities contributes to the possibility that data can be missed or kind of conveniently missed. There was another question in there, hardened by random citizens and private companies jumping in to help. This is good. And it speaks to some of the core of like really nice things about Americans, that like there are a lot of us who are happy to like jump in a tough spot and help. But it also speaks to the systemic defunding, destaffing, essentially the strategic laying bare of our institutions and us as citizens, really. And so these public health agencies are still struggling, even with some federal assistance under the CARES Act, to get the support they need to do the work that's so important right now. And so it's easy to be heartened by these things and to see them as glimmers of hope. I take a more cynical view that these are examples of our essentially our lack of preparedness as government, and that we should not rely on volunteers popping up to do a good deed in our times of crises. We should be prepared.
I'd love to just add to that I also think it's important how you frame that narrative. I think these are really good examples of things that we could institutionalize, like Sarah was saying, so that we're not relying on volunteers. But often when they're in the news, like for example, the guy who created a better New York like vaccination site for $50, it's used to like kind of diminish the government's work and say that, oh, look, he can do this with $50. But that's not possible for governments because one, that's not counting any of his labor. Two, it's on his Wi-Fi and his laptop. So it could crash at any time, which is okay for a volunteer website, but not okay for government. So a lot of times these like efforts by random citizens are held up as examples of why government is so bad and so slow and can't do this. And that's not true. It's because like government is working really hard, but they don't have the resources or the technologists in place to be able to do that. So it's not really like they're doing it instead of government. It's like, how do we get these people to go into government and make it so that our systems are doing that automatically? And that's what they're doing all of the time. And it's not someone's volunteer effort outside of his day job.
Yeah, and I'll say as an example from Washington State, there was a lot of earned media coverage of a vaccine distribution website that launched that was privately developed, or just like letting people know where they could get vaccines. And the first day it really worked well. And then I tried it at later points and it was not accurately showing where you could get a vaccine or sign up to get a vaccine. And so there's also real risks for the public when they're using these volunteer produced resources and reputable civil society organizations.
Kel, Katya, Sarah, any closing remarks, anything that you really want to drive home? I would give the floor back to you if there's anything you want to wrap up with.
Thank you for the opportunity and for the engagement. And hopefully we'll have the report on COVID data and recommendations out publicly at the end of March.
And I'd just like to add, I think like Sarah and Katya are doing such amazing research, and it's awesome that there's so much interest because they're all in this sort of shared like COVID world. And we need to make sure that translates into everyday life. Like every day, these systems need to be working and this infrastructure needs to be in place. So keeping the focus on even when there's not a global crisis is really important.
All right. Well, thank you. Kel, thank you so much. Katya, Sarah, we'll be seeing you soon. And for those of you who want to stay in touch, here's our information. Please reach out, find us on the Beck Center website at Georgetown University, and we will be seeing you soon. Thank you so much for tuning in.
Thanks, everyone.